You feel something in your legs, maybe in your feet, your hands, or along the back of your calf. A sensation that wasn't there a few years ago. And like most people over 50, you probably tried to explain it away. You told yourself it was just age, just a long day, just a muscle that needed rest. But here's the question almost no one stops to ask. Is it coming from your muscles or from your nerves? It sounds like a small detail. It isn't, because the answer may change how you understand everything your body has been trying to tell you. For years, researchers have studied the strange overlap between muscle discomfort and nerve discomfort. On the surface, they can feel similar. A dull ache here, a sharp pull there. But underneath, they come from two completely different systems. And learning to tell them apart may be one of the most useful things you ever do for your long-term comfort and mobility. Let's start with muscle pain, because most people know it well. Muscle pain usually has a story. You lifted something. You walked farther than usual. You slept in a strange position. It tends to be a deep, dull soreness. It often feels worse when you move the area, and better when you rest it. Press on the muscle, and you can usually find the exact sore spot. Give it a day or two, and it often fades on its own. Nerve discomfort behaves differently. Very differently. Nerve sensations are rarely a simple ache. People describe them as burning, tingling, pins and needles. A strange numbness, like part of the foot has gone to sleep and won't fully wake up. Sometimes it feels electric, like a quick shock that travels. And here's the detail that surprises people most. Nerve discomfort often has nothing to do with movement. It can show up while you are sitting still. It can wake you at night. It can appear in both feet at once, creeping in slowly, quietly, almost politely. Before we go deeper, comment below where you're watching from. And tell us, have you or someone you love ever dealt with tingling, burning, or numbness in the feet? Because that quiet, creeping quality is exactly what makes nerve signals so easy to ignore. And that brings us to something worth naming directly. The real problem for so many people after 50 is not the sensation itself. It is temporary relief that ignores the deeper support your nerves may need. Think about how most people respond. The discomfort shows up, so they rub the area. They shake the foot, they stand up and walk it off. And for a few minutes it quiets down. So they move on. But temporary relief may silence the signal without ever explaining why the signal appeared in the first place. To understand that, we have to look beneath the skin. Your nerves are a vast communication network. Billions of tiny fibers carrying messages between your brain and the rest of your body, faster than you can blink. To do that work, those fibers need a few things. They need steady circulation, so fresh blood can deliver oxygen and nutrients. They need protection from oxidative stress, the cellular wear and tear that builds up quietly as we age. And they need a supply of key nutrients that support healthy nerve function. When circulation to the feet and hands slows down, those distant nerve endings are often the first to notice. They sit at the far end of the line, the last stop on the delivery route. So when blood flow becomes sluggish, or when oxidative stress accumulates, those nerves may begin to send unusual signals, tingling, burning, numbness. Not because something is broken, but because they may be asking for support. Muscles, by contrast, run on a different rhythm. They contract, they fatigue, they recover. Their discomfort is mechanical. It responds to stretching, to rest, to gentle movement. That's why a warm bath or a slow walk can ease muscle soreness, but may do very little for that deep, electric nerve sensation that returns the moment your head hits the pillow. This is why telling the difference matters so much. A muscle that aches after a long day is usually just doing its job. But a nerve that tingles, burns, or goes numb again and again may be sending a quieter, more persistent message. And the goal here is not to panic. The goal is to pay attention. Your body tends to whisper before it ever raises its voice. A little tingling, a patch of numbness, a burning that flares at night and fades by morning. These are not failures. They are signals. And understanding the signal is the first real step towards supporting your comfort and protecting the independence you've worked your whole life to keep. So what can you actually do with this awareness? It starts with observation. Notice when the sensation appears. Notice whether it follows movement, like a muscle, or arrives on its own like a nerve. Notice if it lives in your feet and hands, the regions most dependent on healthy circulation. These details are information, and information is power. From there, many people look at the everyday factors researchers connect to nerve comfort. Staying active to support circulation, managing stress, and paying attention to nutrients often discussed in the context of nerve health, such as magnesium, alpha-lipoic acid, CoQ10, and others studied for their role in supporting healthy nerve function and protecting cells from oxidative stress. That's why many people searching for natural nerve support are now paying closer attention to formulas designed to support nerve comfort, circulation, and mobility as part of a consistent daily routine. And one of them is NerveWise, a natural formula created to help support healthy nerve function, alongside the habits that keep your body moving. If you'd like to learn more about NerveWise, Check the link in the pinned comment below. And remember, results may vary. If you take medication or have a medical condition, please speak with your healthcare provider before adding any supplement to your routine. This is especially important if your symptoms are new, getting worse, or affecting both feet. Persistent nerve sensations are always worth discussing with a professional, because in the end, the difference between muscle and nerve is not just a matter of words. It is the difference between a body that is simply tired and a body that may be quietly asking for support. Your muscles will ache and recover and ache again. That is normal, but your nerves speak a quieter language. And the sooner you learn to listen, the better you can support the comfort, the movement, and the freedom that let you live life on your own terms. Because staying independent doesn't start with fear. It starts with listening to the signals your body has been sending all along.